We are currently experiencing a worldwide obesity epidemic. In the United States, 60% of the adult population is overweight, 18% is obese, and 6% is clinically severely obese. Understanding the challenges of bariatric patients is the key to providing them safe and effective care. Obesity is a disease. It's a chronic, progressive, life-threatening disease. Obesity is due to multiple complex factors including genetic, environmental, metabolic, physiologic, cultural, social, and behavioral. Most obese patients suffer from a large number of obesity-related health conditions or comorbidities. In addition, obesity leads to significant physical and psychological impairment as well as decreased quality of life.
I'm looking forward to being active with my children, my grandchildren. I'm looking forward to do normal things. I'm tired of going in a restaurant or going somewhere and looking for a chair big enough. Now these chairs are big enough, but most places you go, they're not big enough. When I go to the auditorium for in-services, they have these little seats that have the little flip-over desk. I can't sit in those. I look forward to not having to concentrate and worry about food, not having to pack a pharmaceutical company with me when I visit relatives in South Georgia. I look forward to having freedom. I look forward to being active, to doing things that normal people do. I look forward to shopping in the Walmart for clothes. I mean, that's important to me. I'm tired of paying $60 for a Lane Bryant dress. It's important to me that people don't stare at me. It's important that seatbelts fit me in other people's vehicles. They're just little. It's important for me to bend over and tie my shoes.
Do not go places much anymore like I did with a lot of people. Going to church, I do go to church, but it's almost got to the point with my diabetes problem that my blood sugar will drop during the church service and I have to get up and leave the church service, and it's kind of frustrating. I get extremely tired, short of breath, walking short distances, standing short periods of time. So it has really put a damper on my life, but I would like to get it back to normal.
Sadly, society sees the obese as second-class citizens. They're called lazy, dirty, and ugly. Obese persons are blamed for their own condition and are not afforded the same consideration as others who suffer from a disability. Obese persons are being ridiculed by teachers, physicians, and complete strangers in public settings, such as supermarkets, restaurants, and shopping areas. Fat jokes and derogatory portraits of obese people in popular media are common. It has been said that obese persons are the last acceptable targets of discrimination.
Since junior high until about a month and a half ago, there was not one day that went by unless I stayed in the house that I was not made fun of for being fat. And so that is about 25 years of being made fun of every single day for being fat. Whether it was a child saying, "Mommy, look, she's going to have twins," or a teenager. I actually have, when I was trying to exercise, have had eggs thrown at me, rotten oranges thrown at me out of car windows from teenagers, or adults saying, you know, looking at your grocery cart and saying, "Do you think you should eat all that?"
I didn't like going out in public because people staring, you know, look at this thing that's coming this way, look at the size of her, you know, she needs to just quit eating type thing, especially when you go out to dinner and you'd sit down and you would eat dinner. You know, people would say that's how she got the way she is because she's eating and constantly eating. So it was I had very low self-esteem, no self-confidence, and it caused a lot of depression to where I did not want to go out and be in the public.
Also with the job situation, I would interview for a job that I had all the requirements and would be able to do a good job, but I felt like I was discriminated against because of my weight. They thought that since I was overweight, I'd be lazy or wouldn't be able to do the job effectively, or I'd be out sick a lot.
The Equal Employment Opportunity Commission says that it rarely pursues a case against a company for discrimination based on obesity. The only protection an obese individual can hope for are local laws such as in San Francisco and Washington, D.C. that ban discrimination based on weight. So why do patients choose weight loss surgery or bariatric surgery? Well, unfortunately, Medical therapy, including diet, exercise, behavioral modification, and medications, is rarely successful in achieving and maintaining weight loss. Currently, weight loss surgery is the only effective treatment long-term.
I probably gained and lost the same 40 to 50 pounds all the way till my early 20s. And then I was really struggling to keep it under wraps.
Every patient believes that they're the only one it's not going to work on because they've tried every diet in the world. They've been successful on every diet in the world and gained all their weight back and more. So this is their last-ditch effort. This is their last chance at a normal life, and they believe they have an abnormal life, watching things from the sidelines, not taking part in their children's lives or their husband's lives.
At Virginia Hospital Center, we offer morbidly obese patients a number of surgical treatment options. First, the adjustable gastric banding, in which an adjustable band is placed around the upper part of the stomach and controls the amount of food the patient can eat. The Roux-en-Y gastric bypass, where most of the stomach is bypassed to create a very small new stomach, and the intestines are rerouted to allow for less food absorption by the body. And finally, the vertical sleeve gastrectomy, where about 85% of the stomach is removed, leaving a small, narrow stomach that can hold a lot less food. Many misperceptions about weight loss surgery remain. Many perceive it as a quick fix, a substitute to self-discipline, or an easy way out.
Yes, I did. I did have a primary physician. He basically did not recommend the surgery because he felt that your size was just due to overeating. Just push yourself away from the table and you won't have a problem.
Patients choose weight loss surgery in order to improve their health conditions, to achieve sustainable weight loss, to reduce life-threatening risk factors, to improve their activities of daily living, to improve their self-esteem, to achieve one's own perception of normal, and after multiple weight loss attempts have failed. However, surgery alone will not guarantee success. Work and long-term commitment are required by all patients. In order to have a successful bariatric surgery program, a number of components are required. Skilled and compassionate surgeons, dedicated, compassionate, and knowledgeable office staff, a multidisciplinary approach to the bariatric patient, including dietitians, psychologists, etc., well-trained hospital staff in the operating room, the intensive care unit, the floor, the emergency room, coordination and communication between various hospital departments and between various caregivers, and critically important, a hospital staff that is sensitive to obese patients. Staff needs to perform an environmental assessment of their area by walking through their unit in the shoes of a morbidly obese person. Examine the equipment, such as toilets, gowns, beds, stretchers, wheelchairs. Are they adequate to meet the needs of the bariatric patient? Also examine the accommodations, such as the waiting room chairs. Look at the doorways. Are they wide enough to accommodate a bariatric bed? Think of your location. Is it easily accessible to these patients? Is the temperature kept at a comfortable level for an obese patient? Be mindful when asking for equipment. Don't ask for the big anything in front of the patient. Avoid making remarks about their size outside their doorway, thinking they can't hear you. Speak to patients in an intelligent manner. Obesity does not numb feelings. Obesity is not a character flaw, but a disease.
Because people shouldn't be treating people when they're fat different than when they are now. Because in my mind, I'm still the same person. They didn't fix my head. You know, they only fixed the body. So I'm still the same person mentally.
Avoid identifications that indicate obesity to others, such as signs or identification labels on equipment referring to obesity or weight limits or bariatric. Be careful with messages left on phones or with marketing campaigns. Unsolicited or inappropriate comments will spoil the experience for the patient. These comments, such as, "You don't look like you need this surgery," or "You carry your weight well," these comments may be offered as compliments but can be perceived negatively by the patient. Many patients feel that their decision to have bariatric surgery is highly personal and don't always tell potential visitors exactly what kind of surgery they have undergone. For staff to automatically assume that everyone is aware of the nature of the surgery may result in issues around confidentiality and could potentially humiliate or embarrass the patient. Having the right attitude is critical. Obesity is a chronic illness. No one laughs at other chronic illnesses such as diabetes or COPD. Obesity can be just as deadly. Train your staff and colleagues to be sensitive by being a good role model. Don't tolerate behind-the-back whispers and jokes about obesity, even in private. If you hear or see someone making disparaging remarks, intervene. Also keep in mind that all of this does not only apply to surgical patients, but to any obese patients you encounter. The price of bias and discrimination in healthcare is very high. Obese people often shy away from doctors and hospitals because they are afraid of being embarrassed or humiliated by medical workers or their surroundings. 80% of surgery patients report being treated disrespectfully by medical professionals. Anti-fat attitudes among healthcare professionals affect clinical judgments and deter obese persons from seeking care. Remember this: rather than feel anger or revulsion toward this person, my first obligation, especially if I am in the helping professions, is to understand him or her, to gain insight into what it is like to be him or her, to imagine and to interpret the world from his or her perspective of experience.